Thank you. Let's just return to our top story this morning and a lack of personal care, poor communication with families and badly trained staff. Now, they're just some of the criticisms in a landmark report into care for dementia patients. Becky Johnson reports.
Shall I get up?
Mary Goulden is clearly in agony as she lies in her hospital bed, but there are no nurses there to help. Instead, her daughter is trying to reassure her.
They're going to come in a minute and sort you out.
She's suffering from dementia, so can't describe the pain or call for help. And her family say she was ignored by hospital staff. Her daughters were so horrified they took it in turns to stay with her, so she was never alone.
The shocking thing was the lack of care she received in so many areas. She was left in excruciating pain. Her food was out of reach and left to go cold. There was no one there to help her. She was left in a chair for hours when she was clearly distressed by this and in a lot of pain. She was left on a commode for 45 minutes at a stretch.
Today's report has found that barely a third of staff questioned at hospitals in England and Wales say they have sufficient training in dementia care. That's despite the fact that a quarter of hospital beds are occupied by patients with dementia. And the number of dementia sufferers in the UK is expected to rise from 750,000 to 1 million over the next 10 years.
Each ward should have at least one member who's had a high level of training. We think that the people who run the hospitals also need to make sure that staff have the resources to manage and help people with dementia and need to make changes to the environment in which people are cared for so that they have things like familiar objects which make them feel less scared of the environment in which they're in.
Do you feel good?
Any changes will come too late for Mary. She died in September.
We are constantly in tears, all of us, because we feel that we let her down. She fought for us all our lives and she would make sure we got everything we needed. But we couldn't do the same for her. Although we tried desperately, we couldn't.
And as they face their first Christmas without her, they fear other patients are still suffering in the same way as their mum. Becky Johnson, Sky News.